You usually know when something's not quite right. Maybe you don't know what. You kind of just say, I don't really feel like myself. I'm tired. Maybe I'm a little snippy, or my mood's changed, or my just motivation is lower now to work out, to live an active lifestyle. And it's very common to be dismissed just because they look at the labs, they say, oh, it's normal. Or even sometimes they look at the age and they say, oh, you're 33, you're 35, you're 40. You don't need to worry about that yet. Most people don't realize that's when your hormones and things start steadily declining in early to mid 30s. It really does take having the right data and being in front of the right provider who can listen, who can connect your symptoms to the labs and say, yeah, no wonder you feel horrible because of A, B, and C. And here's how you fix it. It used to be common perception that you don't really need to worry about your hormones or even really your health or take a functional approach until maybe your 50s, 50, 55, somewhere around there. But we're seeing a really big shift with that in a good way, because a lot of people are becoming more aware of their options. They're looking more into longevity and preventative care, which is great, but they don't necessarily know what they're looking for or looking out for within themselves. And that's where we see that there's still a lot of education to be had with that. For example, traditionally you were told, oh, you're tired, you're 33, you're 35, you're 40, you're tired. You need to improve your diet, exercise, maybe take some vitamins. And that's all great. Those are all really key factors. Lifestyle, diet, we discuss all of those. We call them the pillars of health, right? But you usually know when something's not quite right. Maybe you don't know what. You kind of just say, I don't really feel like myself. I'm tired. Maybe I'm a little snippy, or my mood's changed, or my just motivation is lower now to work out, to live an active lifestyle. You maybe aren't having like major symptoms, irregular cycles, things like that, but there's just something. And it's very common to kind of, again, be dismissed just because they look at the labs, they say, oh, it's normal. Or even sometimes they look at the age and they say, oh, you're 33, you're 35, you're 40. You don't need to worry about that yet. And I think until you're in it, you don't realize how big of an effect your system changing, your hormones changing, how it can really affect you. And that's why, again, coming back to just getting in front of the right provider, getting the right education. We're seeing that a lot too in relation to peptides right now. They're amazing. We've been using peptides for years and years and years. But we're getting kind of more and more people who are reaching out with all these symptoms. Again, low libido, low energy, poor sleep, brain fog. And they either don't know where to start. I think more commonly they've been told that there's nothing wrong with them, especially in relation to, their hormones. And so peptides are kind of broadcast as like this amazing cure-all, which they can be when utilized properly. But low libido, low energy, again, the list goes on. There's something more going on. That doesn't just happen. There's a reason why you're starting typically to experience it in your 30s. Most people don't realize that's when your hormones and things start steadily declining in early to mid 30s. Obviously, everyone's a little different. But again, that's why you start seeing even anxiety, depression, change in body composition. It starts then. That's often just kind of dismissed as a lifestyle, or stress, which is huge. But sometimes you can be doing all the things you should be, working out, meditating, whatever that might look like. But if you're already in burnout, which is so common in our society, unfortunately, lifestyle is important, but it's not going to be able to address fully that root cause. The only way to really get to the root of what's going on is to have the data, but also to get in front of the right provider. Now, when it comes to labs, I think either they're not being checked or definitely not the right ones. We see a lot of really little mini partial panels that get sent in to us where it's a fraction of a glimpse of what's going on with that person. And again, they're told your labs are normal. So they go, great, I don't know what else to do to improve my energy. I'm going to start looking into what else is out there, which again is how they come across peptides. Peptides, they are promoting or supporting your body's natural function. Well, if your natural function is subpar or subpar, you might get a little relief, but it's already working with a system that's in deficit. So again, peptides are an amazing tool. Love them. I'm on a bunch. But if you're not getting to that root cause with blood work, with talking to the right provider, talking about what you're experiencing, the results are just not going to be what you really need fully in our experience. So either the labs are not being checked, or they're being checked very partially and they're told everything's fine. I just had someone tell me that over the weekend. I just had my physical, everything's fine. What was actually looked at? Again, I can almost always recite what's looked at. It's kind of the same 4 or 5 panels that's run once a year. But if you think about how much changes within a year of time, it's really about taking a closer look and more frequently too, especially for women. It fluctuates. A lot of people don't realize a range is just that. When you look at blood work ranges, sometimes they'll range from 4 to 65. That's a huge range. So it's rare that people actually fall out of a range. And if you do, it's probably a much more serious situation at that point. But you can be on the low, or obviously the high in a negative way, a high range. For example, your inflammation, your CRP, that can be within range, but it should be really low. So if you're getting at all elevated, we want to look at what's causing that inflammation. And again, it's about the symptoms. How are you feeling? Especially if you're in your 30s. You should not be feeling tired, moody, low libido. Like that should not, it's normal that it's happening because of the hormones, but it's preventable. It is totally preventable, reversible, treatable, whatever term you want to use. It's just, I don't think talked about enough again. We've had a lot of women be told, I don't need hormones because I had a hysterectomy, or, I'm not old enough, or my levels are normal. But again, all these symptoms, and it's affecting their relationships, it's affecting their professional life, because again, brain fog, just your mood, everything, your energy, it's affecting their children. That's for me. That's why I started doing this deep dive. I felt snippy, I felt short, and I didn't really have a reason to be beyond, I have what everybody has. I'm tired, I work full time, I've got kids, but there was more there. Well, my iron and ferritin's in the tanks, my adrenals are in the tanks, my thyroid's in the tank. So no wonder I'm tired. My body's in a fight or flight response trying to keep up with life. And it doesn't need to be that way. It's actually not that hard to get the help you need and start feeling better, even minutely. It really does take having the right data and being in front of the right provider who can listen, who can connect your symptoms to the labs and say, yeah, no wonder you feel horrible because of A, B, and C. And here's how you fix it. It can be that simple. And we even hear patients when we check in with them, they'll say, I already feel so much better. It's only been a few weeks. Again, it is a process. I'm not saying, miracle always. Sometimes it does take longer, but sometimes it does just take some slight shifts to start to feel better. And obviously it is a journey, and there's going to take some time for some other levels and some other things. The other thing is we get people who they cry in the consult and in their follow-ups because they're just so relieved to have an answer. We've had patients come in and tell us they've been told by their doctor they need to seek help because there's nothing wrong with them, and pretty much they're just going crazy. And we say, no, again, your iron and ferritin's in the toilet, your hormones are tanking, your inflammation's through the roof, like all these things that these people just are trying to get help, Who wants to spend a bunch of money and time in the doctor's office? Like, people aren't just making this up. So it's definitely a real struggle for people, and it doesn't have to be. One of the biggest ones, because who doesn't want more energy, is energy. And again, that was for me too. And so Motzi is a big one. It's great for cellular energy. People feel really good on it. They get results fairly quickly. It's one of the ones that I say people don't really want to stop it. But again, in this society, It is more rare to get somebody whose adrenals are optimal. It is much more common to get somebody whose adrenals are in deficit or in full out burnout. And it's exhausting. Again, you're so tired. And then also people don't realize the effect that once your adrenals are in burnout, or maybe not even quite there, but definitely in deficit, your thyroid actually will usually kick into high gear to kind of compensate for that struggle that your body has. And then your thyroid will get fatigued too. So again, it's very common that if you see something going on with adrenals, it's really common there's something going on with thyroid. And that's, again, what happened to me. My adrenals went first, thyroid followed, because my whole poor body is just doing the best it can. So if I started Motzi, or somebody like that started Motzi, again, you would feel, I'm sure, a benefit and energy. But definitely not as much as you could if you were addressing that root cause, or if you probably ever stop Motzi, you're going to be back where you started. Whereas if we can say, yeah, great, we can get you Motzi, it's going to help, it's going to feel good, but at the same time, we're going to be addressing those adrenals with, of course, lifestyle and stress management, and that is never overlooked. But again, with a proper, supplement or medication routine, that person just went from a slight improvement to, oh my gosh, I feel like a new person. GLPs, weight loss, right? There's a lot of still kind of misinformation, if you will, on GLPs, only because people do it. They do the GLP route without, again, either the proper management from a provider, but also without looking at what's going on underneath. And so they get like rebound weight, or, they get certain things where they're kind of always on it. They can't get the goals they want. They plateau. Well, okay, again, not to keep harping on adrenals, but guess what? One of the most common things with adrenals, you store belly fat. Yes, the GLP can help with that, but if you're just ignoring what's going on over here, the results are going to be minimized, if you will, traditionally. Again, I get people who ask me, interested in coming in, weight loss GLPs, but like, are your patients are they always on it forever? I get asked that. Or do I have to be on it forever? Or am I going to get rebound weight? And I honestly hear patients reach their goal weight. They will either stop completely, and sometimes that's it. And there's a lot of benefits to microdose of GLP. Again, inflammation, insulin, glucose. So we do get a lot of patients, and we know this, that they need it because of the labs. We know that it's not just about losing weight. It's about their glucose, their insulin, their sugars are on the higher range, or even their cholesterol. We see a lot of improvement in cholesterol without medications, just by utilizing some lifestyle adjustments and GLPs. And so there's a lot of benefits to continue microdosing even after goals are reached, but it's not for everybody. It's not always necessary, because we've looked at everything. We've made sure their thyroid, their adrenals, their inflammation, everything's optimal. And so it's a very smooth journey for them. It doesn't have to be this, horrible, long struggle for them. Does anything in this video resonate with you? If so, let us know. And if you know anybody who could benefit from this video, please share it with them.